Hi there, my name is Vic Veer. I'm an ENT surgeon working for the NHS in central London. And today I'm going to tell you about the different specialties out there you can see for your snoring and obstructive sleep apnea problems. So I'm going to go through them one by one. That will hopefully give you an idea of, like, I know I've got this problem, maybe I should see that person. And I've got this other problem, I should see that person. So you can, rather than being passed from one clinic to the next and taking ages to get to the end, you have an idea of who to see as you go along. So I'll start off with this is in no particular order. I'm going to start off with ENT because that's what I know best. The reason to see an ENT surgeon would be if you have a blocked nose in the first instance. If you have a blocked nose, everyone snores. So if your partner who never snores gets a cold or a flu or something like that, they will start snoring that night because their nose is blocked. Nearly everyone snores with a blocked nose. So the way to tell if you have a blocked nose, you can tape your mouth and just see if you can, walk up the stairs and do all those normal things. And if you feel like, oh God, I really got to take this thing off, I feel like I'm really struggling here, your nose is probably blocked. If you look up your nose and you look at this area here on each side and sniff, you might see the walls collapsing in. So lateral walls sort of collapse. And that might be something you should see an ENT surgeon about. If you go like this and sniff on each side, it may be that the middle part of your nose, the septum, this midline partition, is deviated. So deviated nasal septum on one side or the other, which would block one side or the other. If that's the case, another reason to see an ENT surgeon because they can straighten that up with a septoplasty. Another thing to think about is to try an Otrivine or Sudafed nasal spray, which shrinks down something called the turbinates inside your nose. When that shrinks that down, you should be able to breathe on both sides better. Now, in normal people, it doesn't make much difference at all. But if you suddenly feel 10, 15, 30 minutes later, my nose is so much easier to breathe through now, maybe there is a problem with my turbinates. You can tell often when you're lying down on one side gets blocked. If you lie on the other side, it changes over to the other side. If you have any of these problems, it may mean that you've got a blocked nose. And there is a thing called a nose score. I have a questionnaire, online questionnaire you can fill out for free. And nose score is one of those. So fill that out and show it to your GP or ENT surgeon. And they can see that actually, yeah, you do have a blocked nose. And there are, sprays and things like that that can fix all of these problems. Another reason to speak to the ENT surgeon is if you have large tonsils. If you have large tonsils and you started snoring, or if you're snoring for a long time and you're worried that this may be a problem, the national guidelines say that if you have grade 3 or grade 4 tonsils, then you ought to have those removed even before starting CPAP. The same thing with a blocked nose. Actually, it's really hard for CPAP to work in people with big tonsils. So get those sorted out first as per our national guidelines. Other things to look at the back of your throat. So having a very long uvula, the dangly thing at the back of your throat. Now, that doesn't cause snoring or sleep apnea, but sleep apnea tends to lengthen or sort of stretch this uvula down because it sort of gets sucked into the back of your throat. So with time, it stretches and gets longer. And with it longer, it seems to whiptail around during snoring. So, the stretching is a bit like, when you pull an earlobe for too long, it gets longer and longer and longer. Same thing with the uvula. And snipping it or doing all those sorts of things, you've got to be careful as you do it because you'll end up with a feeling of a lump in your throat. But it doesn't fix the snoring or sleep apnea, but it does change the pitch of the snoring. But I'll talk to you about that in another video. The other thing to look at is not the tonsils, but the area behind the tonsils. This area here, the side walls of your throat can collapse in. So if you see these lateral pharyngeal wall cushions, the sort of bulging in from behind, if you look in the back of your throat, you'll see it behind where your tonsils are. You can compare yourself perhaps to a child's throat, or you look on the internet what the side wall of your throat looks like. If it looks very swollen and falling in like that, that's a very strong sign that you've got severe obstructive sleep apnea and you ought to do something about it. And an ENT person would know how to deal with that because there are several operations that stitch that area up. It's a bit like a facelift, but like a throat lift. You pull everything up. We can rearrange some muscles, and it's all a bit complicated. And there are other videos on my YouTube channel which explains all of that. So moving on from ENT problems, you can think about maxillofacial surgery problems. So this is typically, these are doctors that are sort of part dentist, part surgeon, and they deal with the facial skeleton, so the skull, your face, the bones of that area. So they often, in its most simplistic form, deal with a very recessed jaw, an overbite, or a weak chin, all those sorts of things. So if your chin is falling back like that, And therefore, if your jaw is back, maybe your tongue has fallen back as well. So it blocks the back of your throat because your tongue is blocking there. And you need to bring your jaw forward with surgery. They do a very specialized operation called an MMA or double jaw surgery or Bimax, all those other types of names for the same operation or variations of it. And it brings the tongue forward and opens up the throat. Now, I've very much simplified that. If you have a problem with your jaw, think about seeing a max fac surgeon. They help with those sorts of things. Now, I mentioned that a max fac surgeon is very closely related to a dentist. A dentist, I'm sure you all know what a dentist is, but they make a mandibular advancement device. This is a gum shield that goes in your mouth that brings your lower jaw forward. Again, by pulling the lower jaw forward, it pulls your tongue forward and also partly pulls your palate forward as well, the dangly thing and that flap of tissue. Bringing all of that forward opens up more room behind it so you can breathe in and out through your nose, assuming you've seen the ENT person fix your nose. So it's important to see these people if you want a mandibular advanced device. Don't get the ones over the counter, the boil and the bite ones where you put it in hot water and bite it. They tend not to work very well. They are quite useful, however, if you just want to see what it feels like. They are quite chunky and you get a bit of a gag reflex with it in your mouth, and they don't work very well because they keep coming out of your off your teeth all the time. Modern dentists will use digital scanning or specialist impression taking, so you can get the teeth really carefully sort of mapped out. So when they make these mandibular advancement devices, these gum shields, it's really closely adherent to your teeth, so it doesn't keep falling out of your mouth at night. Another thing you could try is something known as a tongue retaining device. It's like a suction cap that pulls your tongue out. It only costs, I think, 10, £20 off Amazon. And it just pulls your tongue out a little bit. And if that helps you with your snoring and sleep apnea, it's not a long-term solution. It makes the tip of your tongue go numb in the morning. But if that helps you, then it may be worth investing in a mandibular advancement device. And we provide these on the NHS as well. Now, partly in the same vein as dealing with the tongue that keeps falling back, you may be interested in positional therapy. This is where basically you sleep on your side, and that instead of your tongue falling back and blocking your breathing at night, it rolls forward out of the way. Now, I don't particularly like just sleeping on your side, and I've got videos on this as well. Try sleeping in what's known as the recovery position, where your face is actually into the pillow, so your tongue can roll forward because of gravity. That really helps open up the airway. I've got some statistics in those videos. So an awful lot of people do get an awful lot better when they can get that tongue out of the way, when they breathe with on their side. In a study that I did on, I think 6,000 people, about 60% of people had only sleep apnea when they're lying on their back. And partners know this. If they see their partner and they go, "Oh God, he's snoring a lot," they just roll you over it onto your side because you snore less on your side because your tongue can roll out of the way. So 60 point something percent, 60.3% only had problems sleeping on their back, and they were completely normal when they slept on their side. Add to about sort of, I think 85.7% of people or something like that noticed that there was a 20% improvement when they slept on their side. Even 85 or 87% of people noticed a benefit, at least a 20% benefit when they slept on the side compared to on their back. So positional sort of devices are really important. So things like the woody nose backpacks, like a huge backpack, like a tortoise or something, and it stops you from lying on your back at all, forces you to sleep on your side. As a minor plug to my own pillow that I've made, if you're using these backpacks and you're finding pain in your shoulder and your hip or pain in your ear because you're pressing your ear on the pillow too long, I've made a pillow which helps you sleep on your side comfortably. But if you're okay using the backpack, you can sleep on your side all the time with no problems. There's no need to buy my pillow. But that's my little plug for the pillow that I've invented. And you can see it. It's called a Side Sleeping Pro. So on to the next thing. If you have obstructive sleep apnea, the most common doctor to see in this country is a respiratory physician, particularly those who deal with sleep. Respiratory physician are the lung doctors. And what they do is give you a CPAP device, typically, a bit like this one here, one way around. It's like a mask that goes over your face and pumps air, not oxygen so much, but pumps air into your lungs and sort of splints open the airways. It works really well in the vast majority of people who can tolerate this thing on their face at night. It's not ideal for everyone, and there are pros and cons to all of these devices. And we can talk about the pros and cons of CPAP in another video. But it is really useful if you have obstructive sleep apnea. Now, a lot of people don't know if they have obstructive sleep apnea. Tragically, about 80% of people out there have no idea they have sleep apnea. So apparently, there's some reports of saying 40% of the population have some form of sleep disordered breathing, and conservative estimates say 4% have really bad sleep apnea that need one of these masks. But 80% of people don't even know that they have this problem. So one way to tell is just to go on the Stop Bang website. It's a free website, and you can just input your details into that, and it will tell you your risk of getting or having obstructive sleep apnea. Other thing to do is think about all the symptoms that you may or may not have. So a lot of people with snoring that snore so loud that they can be heard through a closed door, then you're very likely to have obstructive sleep apnea. If you're waking up at night to pass water, to have a wee, whatever you want to call it, then it may not be a prostate problem or because you drank a little bit too much water and things like that. It may be that you have obstructive sleep apnea, particularly if you're a snorer. If you wake up in the morning and feel slightly tired and unrefreshed, or if you wake up with a morning headache, any of these things would point towards the fact that you may have obstructive sleep apnea. If you feel tired before 11 o'clock and you need a cup of coffee just to keep you going, that's not right. You should be getting enough sleep so you wake up refreshed and you don't need anything at 11 o'clock. So have a think about that as a possibility that you may have obstructive sleep apnea. The most common sort of doctor out there is a respiratory physician that helps people with sleep apnea, and they'll give you a CPAP device, a mask that goes on your face. Now, you may not like it, but wear it. And so at least you're safe while you're trying to figure out what are the other options for you. But it's the right way to go at the very start because you need to be able to breathe. You need to avoid all the risks of sleep apnea. It causes high blood pressure, diabetes, strokes, heart attacks, depression, infertility. There's all sorts of things that it causes. So why have all those things? Wear the mask now and then figure out which direction you want to go after that. You may love the CPAP mask and never want to come off it, and that's great. You're already on the right treatment and you can live with it. But yeah, there are loads of options out there, and that's what this video is all about. If you are overweight, and when I say overweight, I raised BMI. So you can look up BMI on Google. But particularly if you've got a lot of fat on board and you've got a raised BMI over 25, whatever, then there's a chance that losing weight would improve your obstructive sleep apnea or snoring problems. If you've just started gaining some weight and you just started snoring, then it's a really good idea to lose the weight now, because if you stay snoring for a very long time, it tends to stay with you even though you've lost the weight. Because losing weight, particularly say 10 kilos of excess weight, is really good for you in lots of different ways, lots of different health benefits. But it has a sort of mixed bag when it comes to snoring, which has been going on, or sleep apnea that's been going on for a long time. Typically, we say that snoring and sleep apnea gets about 30 to 40% better when you lose all your excess weight and bring your BMI down to a normal level. But often that's not quite the case. It doesn't solve the problem in most cases. In fact, I think it only solves the problem long term in about 3% of cases. But these are chronic long term problems. But 30-40% improvement in your snoring and sleep apnea, if you've had it for a really long time, is a great idea. And there are things out there like Manjaro and bariatric surgeons and things like that. So talk to people about getting those. As I said, it doesn't solve an awful lot of the problems. And people sort of ask me, why doesn't it fix it? Because it fixes it at the start. And it's about, when you snore for a very long time, you damage the nerves in your throat and it don't, um, how do I explain it? So say, those people in the road with a jackhammer and they're trying to break up concrete with these big hammers. Over a few years, they lose the sensation in their fingers and they don't work quite as well because of the vibration damage to the nerves. The same thing we think happens to the back of the throat. When you're snoring all night, vibrating around, with time, it seems to damage the nerves in your throat. And so it doesn't keep the tone in your muscles quite as well as it did before. So it doesn't work very well like that. Also, with everything being stretched, because remember I was saying before about the uvula, other things get stretched as well. They get stretched past their like elastic limit, and so things more easily fall back and block your breathing. So as I said, if you've just started snoring, you've just started gaining weight over Christmas or something like that, then lose the weight. rather than letting it become a chronic thing. If you have lots of excess weight and you're trying to get your snoring and sleep apnea better, then lose it if you can, but don't expect it to cure things because it doesn't really cure things. The Mounjaro and these other drugs that meant to help you lose weight by basically encouraging you to starve yourself, it works really well about losing a lot of fat. But the thing that's happened with, snoring and sleep apnea problems is that you can't lose that much fat so quickly without also losing muscle. Now, losing a bit of your thigh muscle or arm muscle, it's not that a big deal for sleep apnea, but you also lose the muscle in your throat as well. So you don't have quite the strength of the muscles in your throat. So things start sagging down a little bit because it doesn't have the strength to keep it open. So we see, slight changes in what we call the phenotypes, the muscle responsiveness. And if you're a long-time viewer, you might hear me talking about these things. But just be careful to think that losing all the weight will solve all your problems. It doesn't. It's an important part. And if you have a real weight problem, go and see a bariatric surgeon. And I'll talk about it now. If you, in the past, have been doing a lot of bodybuilding, particularly those who've used growth hormone and testosterone to, augment your muscles, it does augment all your muscles. And clearly, I've never taken any of those drugs. But if you have uh, really tried those or done a lot of workouts, the throat muscles also expand and block your airway. So, like I said, it's BMI. It's not how much fat you are. So these muscle gyms with people with 5% fat in their bodies, a lot of them will have obstructive sleep apnea. I think there are reports of above a certain sort of weight percentage, 80% of people have sleep apnea. So all these muscle gym people go home with one of these masks on their faces. So just be wary. I think when I explain this to people who have built up a lot of muscle, I say to them, look, if you push your body to extremes, extreme things happen like sleep apnea. And it may be worthwhile trying to lose that muscle, particularly in your throat. So be careful about that. Losing muscle is really hard because I've seen these people, they don't want to lose muscle at all. They've worked really hard for it. And that's another topic altogether. I've got videos about weight loss and weight gain and things like that. So look at that. Closely related to the muscle thing, there are people called myofunctional therapists. In this country, they're not really part of the NHS yet, but basically they help with training the muscles at the back of your throat and toning up the muscles. They do other things as well, but for me, the thing that works best for me is those tightening up the muscle so the tone is better. So you're not falling to bed and all the muscles sort of sag down. It seems to happen to people who have never snored in their lives, never had sleep apnea, but as they got to the age of sort of 60, 70, 80, because we lose 3% muscle mass per year on average. We don't really exercise our throat muscles. We don't sing and do all those things that maybe the Waltons used to do. So we don't exercise our throat muscles as we used to do in the old days. So perhaps exercising these muscles, tightening up, seems to help. It works best, I seem to notice, in those who are in the older age groups, which is why I mentioned that demographic. But it can help even in younger groups as well. So if you're maybe just taking loads of Mounjaro, you've lost all the weight, but you've noticed that still snoring, having problems, it may be worth trying to tighten up the muscles in your throat as well to stop it from sort of slagging down and flapping and losing its tone. So speak to a myofunctional therapist. They'll give you a much more detailed sort of idea of what's going on there. So changing tack ever so slightly, there are hormonal changes that can affect you and cause snoring and sleep apnea. Some women even notice that they have snoring and sleep apnea problems during their menstrual cycle, during pregnancy, during and after the menopause. And actually, the menopause is really important because by the age of about 60, the girls are caught up with the boys in terms of snoring and sleep apnea. So it's almost exactly the same by that point because before, with the estrogen and progesterone, women are protected. Their bodies are a lot more elastic to allow, delivery, pregnancy, and things like that. But they don't need that after menopause. And so you lose those hormonal advantages and you become, your skin isn't quite as stretchy and springy as it was before. Um, I'm not trying to depress every sort of postmenopausal woman there, but it is a factor. So if you have a problem like that and you're really struggling and you think, actually, this is not really working for me right now. I haven't got time to sort out all my sleep apnea things. Everything is sort of crowding on top of me. It may be worth speaking to an obs and gynae surgeon or a GP or someone who's interested in menopause and hormonal changes, because they might be the person to help you with like, okay, if you've got all these other things to do, losing weight and your thyroid problems, etc., then maybe we'll give you HRT just to put at least this aspect out of the way first. And there are pros and cons to HRT, which as a surgeon, I know nothing about. See the right people for the problem that you have. So that's one thing. The other thing to think about is seeing an endocrine doctor. Endocrine means people with, again, hormones and things like that. So I would say thyroid problems. If you've got low thyroid problems and you need to get this checked, you should see an endocrine surgeon or endocrine doctor who will help you work out why this is happening and give you some supplements to bring your thyroid levels up again, because it just sort of slows down your whole body. But things like acromegaly and cortisol problems, all sorts of things, adrenal issues, all cause problems which can lead to obstructive sleep apnea and snoring and things like that. The endocrine doctors also deal with testosterone normally, so speak to them if you're having low testosterone levels, but be careful with testosterone because it can build a bit too much muscles in the areas that you don't really want. The next thing to think about is sometimes the side effects of obstructive sleep apnea and snoring things. So for example, you may have cardiac failure. So your legs become a bit more boggy. When you push your finger into the skin of your ankles, you leave a little indentation that slowly fills up again. A bit like one of my pillows. You put your hand on it and it slowly fills up again. That may be happening to your ankles, which indicates that you may have either heart failure or something else. And a cardiologist will help you with that because heart failure causes sleep apnea and sleep apnea causes heart failure. It's this horrible cyclical relationship between the two. So try and get that sorted. The other thing to think about is a nephrologist. So if you put your finger on your ankle and it springs up straight away, it doesn't really leave an indentation that slowly fills up. It may be that it's your kidneys that are causing the problem, which itself can cause obstructive sleep apnea. Obstructive sleep apnea can cause kidney problems through diabetes officially, and endocrine doctors deal with diabetes as well. So there's all sorts of things around the endocrine side of things. So get that side checked out. If you've got any propensity in your family history for that sort of thing, then maybe speak to an endocrine surgeon. Just look, can you just check me over and just check that these things are sorted? And because I don't, I feel like I'm starting to snore. I'm worried that this is something my dad had as well. Talking about cyclical things or vicious cycles, depression and other mental illnesses can cause obstructive sleep apnea. A lot of people think it's like the other way around. You get sleep apnea, and therefore you're depressed and just need to fix the sleep apnea. But it can be the other way around. Another vicious cycle. Depression causes sleep apnea causes depression. And I think a lot of people don't realize that depression's not like, oh, you just need to pull yourself together, just get on with it. It's a pathological thing. It changes your body. There's less sort of neuronal drive going to your body. And so your tongue and your throat all sort of collapses in and causes obstructive sleep apnea. The opposite is true as well. If you're sleep deprived, you feel awful, you've lost your job, and your snoring has driven your wife out to the other room, or you've gone to the other room, that can make you depressed as well. All those life changes. So see a psychiatrist. Those are the right people to see for that situation. And often psychiatrists deal with the insomnia as well that some people get with sleep apnea. Insomnia is very commonly associated with sleep apnea because people are either frightened to go to sleep because they're embarrassed about the snoring and it's upsetting their partner, or the sleep apnea is waking them up in the middle of the night and then they can't get back to bed again because their heart's racing when they wake up, and all these other problems that can happen. So seeing a psychiatrist to help you through that side of it and let another specialty deal with the sleep apnea is a really good combination. It deals with two problems at the same time because sometimes it's hard to deal with one side of the vicious cycle if the other one's still feeding it. I hope that makes sense. Closely related to psychiatry is neurology. So a neurologist, a sleep neurologist particularly, but normal neurologists can deal with myasthenia gravis and muscular dystrophy and all those sorts of things. They deal with neuronal problems that mean that the tongue and the throat all collapse in. If you've had a stroke, for example, in this area here, your throat will collapse in and block your breathing and give you sleep apnea. So they're the sorts of people to talk to you about that and try and reduce the risk of that happening again, or mitigate the problems caused by these diseases. I'll have to admit I'm underselling the neurologists a little bit, because actually there are sleep neurologists out there that deal with all the other aspects of sleep problems, such as parasomnias, all sorts of restless legs problem or REM associated issues, sleepwalking, sleep talking, exploding head syndrome. There's all sorts of things out there that these neurologists deal with, but I'm particularly talking about snoring and sleep apnea. But if you have any of those other things, and I've got a questionnaire that I give out to people that look at all the parasomnias and then direct them to a really good neurologist that can help them with all those problems. So I'll move on from neurology, and the next one is medication or drugs and things like that. So when I say drugs, it could be just simple smoking. Smoking causes inflammation of your nose and your throat and can block up your breathing a little bit. It takes about 3 months after stopping smoking, and it tends to open up your airways at that point. The other thing is alcohol. Now, I think most people know that when you drink alcohol at night, you dream less, and therefore you get cognitive problems in the day and for at least a week or so afterwards. But also it means that the muscles in the back of it relax more, and you start snoring more, and you have more sleep apnea. It's harder to wake you up, so your oxygen levels drop even lower. So drinking and being drunk when you go to bed is not a good idea. So if you're having these problems and you're thinking, actually, there are so many things going on, I've menopause, thyroid problems, obesity, and insomnia. uh, Drinking is an easy thing to stop. Um, because it'll help one of those sort of, those associated things that are all driving problems in you. If you cut out the drinking and the alcohol and the smoking, that might help. It's difficult, I know. And some people are so stressed they need to drink at the end of the day. But seeing someone about that, maybe a psychologist, a psychiatrist, or someone who deals with alcoholism, might be helpful if you're struggling to stop the alcohol. It may be just a temporary thing as you get yourself back into order again. But if you're having trouble, speak to one of these specialists that can help you with alcohol. I touched on saying something about stress and maybe sleeping late and having shorter sleep cycles. Because if you're working really hard and you're really dog tired when you get home and go to sleep, you're more likely to snore. Everything is just like you drop into REM or dream sleep very quickly because you're just so tired. You've got so much going on in your head. And often people snore when they're really tired and really stressed. And I don't know who you'd see, a GP or a life coach, all sorts of people can help you with your stress. Speak to your employer if you're working for someone. If you're really stressed, try and change your lifestyle if you can, and just sleep for longer. It means that you'll stop gaining weight, because sleep deprivation causes weight gain. All sorts of things would improve if you slept better, less stressed. And dealing with the stress, psychiatrists, psychologists, all those sorts of people will help you with that side of things, because it really does make an impact. I mentioned previously about drugs as well as medication. So there are an awful lot of medications out there that cause or can make snoring and sleep apnea worse. So, for example, if you're not on the right dose of thyroxine, it might be that you never snored before, had a thyroid problem, and you started taking thyroxine, your blood levels are okay, but they're just on the lower end of normal. Perhaps you were always at the higher end of normal. That's where you normally run at. The range for human beings is between here and here. And you may have been up here at the start. You lost your thyroid function. It came down to here. And then your doctor says, well, I'll give you a little bit to bring you up to here. Now, for you, from here to here is a big step, but you're within the normal limits, because most, humans are in between this range. That might not be good for you. You should be slightly higher up. And so talk to your endocrinologist about that. And there are drugs like antidepressants and other drugs, sort of opiates, and drugs that make you feel that the throat collapses in, reduces the tone in your body, muscle relaxants, things like that. So if you're on any of these drugs, they can cause snoring and sleep apnea. So look through your medications. There's a website in this country called the BNF, British National Formulary, or whatever you want to call it. I don't think you can get it abroad, but have a look at that. Look at the side effects of all your medications. Speak to your GP or speak to your pharmacist. 'Cause pharmacists know like literally everything about drugs. That's their life, and they're so good at saying, actually, yeah, these 3 drugs are fine, but if you combine them, they go a bit haywire. There's all sorts of things that they know that, you know, like simple surgeons and even GPs and other people wouldn't be able to understand. So speaking to your pharmacist and saying, look, I've just started snoring. Here are my medications. Can you just help me go through it? Because they're brilliant at that sort of thing, just teasing out and diagnosing in that sense. They're the best people to speak to. I did mention earlier about growth hormone, testosterone, using it sort of illegally to boost your muscle levels. And certain other drugs do cause that again. Opiates will do that. Cannabis causes it. There's all sorts of things out there that can cause trouble. Yeah, even amphetamines, and they sort of you use them to sort of make your brain go hyperactive, but then afterwards, when you come down, everything with time, it can sort of dull your brain a little bit. I'm not saying they all do, but there is an awful lot of information out there which, with long-term chronic abuse, can cause problems. So just be a little bit careful and look it up and just understand what you're getting yourself into. There's a reason why these drugs are illegal. Then we don't make them illegal for no good reason, just to spoil your fun. Just be careful. And I should say that although you're saying, oh, you can see all these medical specialties, and there are probably, I don't know, 14 or something I've talked about now, there are lots of other ways of getting help. It doesn't have to be from a doctor. I often talk about the Hope to Sleep Facebook forum because it's a really lovely bunch of people out there who are trying to navigate their way through all of these problems. It's really hard. And you can hopefully tell from this really long video, and I didn't realize I'd be talking for this long. You can tell from this really long video that it's difficult to know which direction to go. And I'm not saying that doctors are not to blame. We are to blame. We haven't invented a sleep doctor or a sleep team. There's very few sleep teams in this country. I'm, privileged to be a part of one, but it's really hard to figure out what to do. It's not a specialty that any of us really got taught at med school. 30 years ago, we didn't get any training on sleep. So it's something that's evolved over time. So being in one of these forums, the Hope to Sleep charity forum on Facebook, is really good because there's lots of nice people willing to help each other out. And you say, "Oh, look, I've got a problem with my mask, or I've got this thing. Do you think this is going to be a problem? I've got anemia. I'm struggling to breathe. Do you think that's also making an impact on your sleep apnea? Yes, it does. I'm going to go move to somewhere with high altitude. Do you think this is going to make a difference? Yes, it does. So there's all sorts of things that I haven't really talked about in this video that can make your snoring and sleep apnea worse. So although you can speak to all these professionals, doctors generally are not very good at talking to patients, and sometimes talking it through with other people so that when you do speak to your surgeon or your doctor or whoever, you have a little bit of like knowledge behind what you're saying, so you can communicate better and you can understand what they're looking for and what you're looking for, and it becomes a consultation. We talk to each other and guide ourselves through to get the result that your patient really needs. I'm mixing up my my nouns now, but I think it's really important to have a community around you to look after you. And I hope this video has been of some benefit to you. And I'm sorry about the little plug about my pillow. I promised myself I wouldn't talk about my pillow because it's all in my head at the moment. It's all I think about. If you're interested, I'm hoping it's going to come into the country any day now. So fingers crossed. It has to get through customs and it has to get to the warehouse, but we're very close. Anyway, really hope you enjoyed this video. Hope it's been of some value to you. I'll see you in the next video. Bye-bye.